I'm Rajinish Menon. I'm the CEO of Sukhino Healthcare. Today, the issue of chronic ailments and the number of people who suffer from chronic ailments in India is very staggering. You have close to 1.8 million people who suffer from various neurological diseases. You have close to 1.2 million people who suffer from cancer, various types of cancer. And if you add the various types of chronic ailments, the numbers are sheer staggering. Add to this, you find the society is getting, nuclearized in most cities. The numbers, the nuclear families is something that's a recipe for disaster. The pressure on the ecosystem, on the healthcare ecosystem is very, very high. And it requires a special type of a care where you don't pressurize the ecosystem. You allow the family carer also to take care of the individual in the best possible manner. And all this requires a lot of innovation in the field. And India, as in the case of telecom, will leapfrog into the next level where it can take care of its people. Given the humongous numbers and the fact that we are a capital for most of these diseases, clearly, the number of people, the young number of people in this country, plus the technological advancements that we do in our country and world over is something that is going to be a solace for us. I truly believe that a combination of a good number of qualified people across the spectrum, whether it's doctors, nurses, caregivers, and the technology adoptions, where with a simple telecall, you're able to primarily take care of the needs of an individual staying way far away from wherever the healthcare facility is, and then provide some immediate succor itself is a very, very great advantage. And I think going forward, there will be a combination of health tech and good people, caring people coming together to give a respite for the challenges that we currently have. Sukhino was an idea that I had, because I had to take care of my loved ones, my mom and my sister who are cardiac patients and who are chronic ailment patients. And the very fact of taking care of them in India, where you have expertise, healthcare expertise in silos, made me realize that you need a partner with whom you can go from A to Z and you can trust them from A to Z, so that as a healthcare patient dependent, you are free to do your job and your loved ones are taken care in the best professional manner. That was the entire idea of how we started Sukhino. And I'm very glad that the people have adopted this model. I'm very glad that the consultants of most people have really liked this model and they have been advocating and have been evangelizing the model to their patients. I see a great opportunity for Sukhino going forward. Sukhino Healthcare as a company was formed in 2015 and started commercial operations in 2016. The idea behind Sukhino was how do we provide, as I told you earlier, the succor to the people, which is trying to be the trusted advisor to them, trusted partner to them, and provide a continuum care of services. This is something very new in India, the continuum care. And we are trying to understand how can we be relevant to a patient who's suffering from chronic ailment, how can we be relevant to the patient family who has a dependent who's on chronic ailment. And over here, what Sukhino does is that it works very closely with the primary consultant, it works with the patient family, and it provides a long-term caring plan revolving around both recuperation and rehabilitation by working with the primary consultant, by ensuring that the same treatment protocol of the primary consultant is followed to the T. So whether the patient requires care at home or the patient requires a care at our facility, I'm very happy to let you know that Sukhino runs a transition care centers. We have 5 of them in Bangalore at this point in time. We have 1 in Kochi. These are transition care centers modeled across what you see in very advanced countries like the United States and Australia, where people who require post-operative care will be taken care in our center, stabilized using recuperative and rehabilitative methods, and then sent back home, also with a carer, so that the entire nursing and the recuperative care of the individual is completely taken care of, and the chances of re-hospitalization is avoided or is minimized to a large extent. And the good thing is, since we follow the treatment plan of the primary physician, the primary physician is also updated about the patient's condition. So overall, it's a win-win situation for the family, for the treatment doctor, for the treating doctor, and for Sukhino as well. This is what we do. Sukino, by virtue of being a continuum care provider, it is, as I told you earlier, provides the same treatment plan of the physician, A. B, we try to provide the same carer, whether it is at a home or whether it is at the hospital where the patient is taken care of, or whether it is in the center that we run. By ensuring a common carer that has been given to you, there is a lot of continuity and the patient is at ease. Thirdly, we have fantastic all types of clinical excellence in our center and in our home care, which is totally different from what most people do in India. We are not a home care per se agency, we are not a hospital, but we are somewhere between a midway between a hospital and a home. And our endeavor is always to take care of patients, give them the comfort of a home and give them all the clinical excellence that you find in a hospital. That is the biggest advantage that Sukino brings to the table. The way the Sukino's continuum care model has been adopted by the patients and by the doctors, both here in Bangalore and in Kochi, I am very confident that we can grow and we have an opportunity to grow and establish the continuum care industry in India. That said, we are currently in Bangalore. We have about 200 beds in operations, and our endeavor is to increase the bed capacity to at least 300 to 400 in Bangalore. We clearly feel that there is a demand for such a services, and after ensuring that we completely pilot the model and the services really matured in Bangalore, we will be going to other cities in South India to start with and then to North. So we are taking baby steps, because remember, this is healthcare. We want to ensure that we do it in the right manner. We are here to help people, and we want to ensure that at the end of the day, the patient and the patient families feel they are completely comfortable in our hands. Sukino, the word comes from Om Loka Samasta Sukhino Bhavantu, that is, free the world from suffering, and we are here to do that.